Hello everyone and welcome po sa pag-usapan natin. Okay, ating pong pag-usapan ngayon ang isang kondisyon na nakakaapekto o nakakabagabag sa mga kalalakihan mula edad 17 hanggang as late as 80s. Ito po ay ang tinatawag nating prostatitis. Bago po ang lahat, magpapakilala lang po muna ako. Ako po si Louie, Austria. At ako po ay isang prostatitis survivor. Bukod sa pagiging survivor ng prostatitis, ako po ay isang medical researcher, legal practitioner, and of course, among many things, I am also a part musician. Pero how does my experience and how my background relates and becomes relevant to prostatitis? Well, I was diagnosed with prostatitis back in May 2018. I'm happy to say that exactly 1 year after I was diagnosed, I became fully healed and cured of this debilitating and annoying pain called prostatitis. So, ano po ba ang prostatitis? Prostatitis po ay ang pamamaga ng prostate gland ng lalaki. So, before anything else, ano po ba ang prostate gland? Well, basically, prostate gland, siya po ang responsible sa pag-release ng semilya ng lalaki. At ito po ay isang gland na makikita sa ating uroreproductive system. So, ang prostatitis po, take out the name titis, which means usually associated with inflammation. Ito po ay ang pamamaga ng ating prostata. Ngayon, ang pakay ko po ngayon dito sa episode na ito, i-discuss muna natin kung ano po ang mga various concerns regarding prostatitis. Unang-una, hindi po ito ang enlarged prostate. Ang enlarged prostate po ay ang paglaki ng prostate. Ito po ay nanigas at nagkaroon ng mga laman. Pero ang prostatitis ay hindi po ganoon. Hindi po naninigas o nagkakalaman ang prostatitis. Ito po ay isang infeksyon o pamamaga lang ng prostate. So, bakit po ba namamaga ito? Marami po tayong causes ng prostatitis. Kung bakit namamaga ito, it could have been caused by pathogens or by non-pathogen factors. Doon muna tayo sa pathogenic factors. Pathogen factors, maaari pong ma-infeksyon ang ating prostate at mamaga gawa ng bacterial infection, gawa rin po ng viral infection, parasitic infection, at yeast or fungal infection. So, doon muna tayo sa bacterias. Ang bacterial prostatitis po ay ang pamamaga o infeksyon bunga ng sari-saring bakterya na makikita o makaka-invade sa ating uroreproductive system. Ang mga classic example po nito ay ang mga STD or STI causing bacteria, ranging from chlamydia, gonorrhea, the usual suspects which are naturally occurring in our body, like, we have E. coli. Ito po ay usual na bacteria na nakita sa ating colon system, pero kapag ka po ito ay pumasok sa ating urinary tract, maaari nga pong ma-invade ang ating uroreproductive system. There are many other bacteria which may be naturally occurring in our body that could infect our prostate. Ito po ay kapag masyado na pong dumami itong bacteria na to sa reasonable amounts na kaya o require ng ating katawan, maaari itong maka-infect o maka-invade ng iba-ibang reproductive or productive systems natin, katulad po ng prostate. So, ang possible cure lang po rito ay ang mga antibacterias. Ang problem lang po natin kapag ganito ang cause ng ating prostatitis ay minsan napakahirap pong ma-detect kung ano ang cause ng bacteria. Ang good news po rito is it's curable with antibiotics. The hard part is how do you determine which kind of bacteria is infecting your prostate, because ang prostate po ay nasa labas po ng ating iihan. Meaning, kung papakita ko po sa inyo, kunwari, ito po ang daluyan ng ating ihe. Ang prostate po ay nakabalot po sa labas na ganyan. At meron lang po siyang mga glands or ducts kung saan lumalabas ang ating semilya kapag ito ay nagpapump. So, kunwari ito po ang daluyan ng ihi. Nandito po ang prostate. So, ang prostate po, kunwari, let's say nagkaroon ng stimulation, magko-contract po ito para mag-pump ng semilya paloob at lalabas sa ating tinatawag na urethra o ang daluyan ng ihi. So, kapag ka ang bacteria ay nandito sa prostate at siya ang nagkakos ng infeksyon, mahirap po siyang ma-detect sa simpleng urinalysis. Sa mga nagsasabi, bakit po ako ay nag-undergo ng urinalysis at nakita meron pong bacteria sa aking ihi after urine culture. Well, maaari po yun. Maaari pong nung kayo ay umihi, na-detect o sumama kagad ng bacteria sa iyong ihi, maaaring ang nararamdaman nyo ay hindi prostatitis kundi urinary tract infection o tinatawag nating balisaw-saw. Pag UTI, at uminom kayo ng antibiotics based sa urinalysis, nakita kung anong klaseng bacteria at nalaman nila kung anong antibiotics ang kailangang inumin at kayo'y gumaling, maaaring hindi po prostatitis ang naging sakit ninyo, kundi tinatawag nating urinary tract infection. Kasi sa urinary tract infection o tinatawag natin UTI, ang bacteria usually nandun lang sa daluyan ng ihiyan. Lalo na pag early stages lang ang agapan. So kapag umihi kayo, nasasama po yung bacteria sa ihi at kapag na-test nila, makikita nila anong klaseng bacteria at kapag uminom kayo ng antibiotics, gumaling kayo, malamang UTI lang po ang meron kayo. Now, sa ibang kaso naman po is hindi UTI pero sasabihin nila prostatitis at gumaling sila dahil nakita sa urinalysis ang kanilang bacteria. Pwede rin po yun. Maaaring naglabas kayo ng semilya that day or immediately before kayo umihi. At nung umihi kayo, man natitira pa pong semilya na merong bacteria na natatrace mula sa ating prostate doon sa urine tract ninyo. Nung umihi kayo, maaari sumama sa urine sample ninyo at nakita, good for you at maaari nakita kagad kung ano ang antibiotics na maaari yung i-take at nakikure. Sa ibang instances naman po assays, hindi kagad sumasama sa ating semilya. Maaaring nandun lang sa, kunwari itong prostate, nasa taas o nasa loob, pero hindi mismo sa kung saan gumagawa o restore ang ating semilya. At doon minsan nagiging mahirap i-detect kung anong klaseng bacteria ang meron tayo. So in that case, ang usual na ginagawa, based sa experience ko, ako po ay nagpa-digital rectal examination at prostate massage. Doon sa prostate massage po ay ipapasok po ng doktor ang kanyang daliri sa ating puwitan at imamassage at ipisil-pisilin ang ating prostate hanggang sa maglabas tayo ng semilya. Sa ganung paraan, pag lumabas na po yun, ikakatch nyo po yun sa isang tasa o specimen cup at yun po ay yung pa-culture test. Sa culture test, makikita po nila kung anong klaseng bacteria meron kayo. Bukod po doon, siguro mas safe siguro kung after ng sinasabi nating prostate massage ay umihi po kayo sa isang specimen cup dahil doon isasama po ng ihi kung ano man pong natitirang semilya. Hopefully, doon sa semilya makukuha ay may mga bacteria po na masasama at maaaring matrace po ng urinalysis or ng urine culture test. And the third aspect po ay ang tinatawag po natin na semen culture, kung saan tayo po ay maglalabas ng ating semilya at iponin sa ating specimen cup at ibibigay po sa laboratory immediately for tinatawag nating semen culture analysis. Basically, bakit po tinatawag na culture? Culture is hinahayaan po natin mag-grow ang bacteria kung meron mo pong naipon doon within usually 3 to 5 days. 3 to 5 days, pag nagkaroon ng tinatawag natin colonization or pagkalat ng bacteria, doon malalaman kung infected ba ng particular bacteria, usually negative gram, ang inyong specimen culture. So, yun po ang bacterial infection ng prostatitis. Bukod doon, meron po tayong tinatawag po na viral infection. Sa viral infection naman po, ang common dito which could infect and invade the body are tawag natin herpes, ano pa ba? Non-usual virus, maaring ma-invade ka lang ng virus nun for a particular time, pero your immune system would actually fix it and manage it, and after a while, mawawala na po yun. So, medyo mahirap po ang viral infection na cause ng prostatitis because it could be something that is determined and treatable, or it could be like tinatawag natin like yung foot and mouth disease, or yung tinatawag natin like pox. It's something that would affect us but would be managed by our body. So, it's just something that we have to wait out on. Kumbaga, mag-antay lang tayo, kusa na lang mawawala. So, we have that viral infection. And then we have the parasitic infection which causes prostatitis. Ano po ang usual na parasites? Ito po ang tinatawag natin trichomoniasis. Trichomoniasis is something that's sexually transmissible. Trichomoniasis actually is treatable. But if it's already in the prostate, medyo matatagalan po yan. But yes, is it treatable? It is treatable with tinidazole or metronidazole. And of course, before you try this medication, seek your doctor's medical advice and seek proper treatment. This is just a result of my research, and it's not something that you should do without medical supervision of a licensed physician. Bukod po sa tinatawag nating parasitic infection, meron din po tayong tinatawag na yeast or fungal infection. Ang fungal infection or yeast infection usually occurs in our body kapag namamatay po ang ating good bacteria at nag-i-invade ang fungal cells or yeast cells. And usually, nangyayari ito kapag nasobrang ka ng antibiotics, napatay na ng antibiotics hindi lang yung bad bacteria but also the good bacteria that regulate your system. At pag nagkaroon po ng proliferation ng yeast or fungus or fungi in our body, of course, it would invade and infect certain organs. And in case of prostate, mamamaga po ang prostate at napakahapdi po ng pakiramdam niyan. On another end of the spectrum, meron po tayong tinatawag na non-pathogenic prostatitis. This is the inflammation of the prostate caused not by pathogens, but rather by damage in the nerves, injury, or weakness of the pelvic muscles. The upside of this is wala po tayong dapat ikaworry na merong nag-invade or merong nag-i-infect sa atin ng bacteria na kailangan nating i-trace. Downside po nito is that there is no known treatment for it. Meaning, hindi ka pwede mag-take ng meds that could actually cure and reduce the inflammation. What you may do is pain management, which of course could be done through exercises. But of course, may mga certain exercises depende sa kind of injury or kind of nerve damage that you may have. Maaaring hindi nyo po ma-perform. Pero, be that as it may, the better part of this, I'm not saying pathogenic and non-pathogenic prostatitis are good, but of course, they have their own upsides and downsides. The upside of this is that you don't have that lingering concern na maaaring mayroong virus ba or mayroong bacteria ba na nag-infect ng prostate mo, na nag-cause ng prostatitis. Meron ba akong STI or sexually transmissible infection? Meron bang bacteria ako na maaaring nakuha ko sa pahipagtalik? Wala po tayong ganung concern na katulad sa pathogenic, particularly bacterial prostatitis. Pero, ang downside naman po nito is, anong cure maaaring meron ako? It may take a while for you to find a treatment, not cure, a treatment, which is consisting either of pain management or taking anti-inflammatory or painkillers, which the downside is it could be addictive or it could affect your kidneys. Pero, yun nga, in due time, I have known some people who had chronic prostatitis or chronic pelvic pain syndrome. Na-manage na po nila through exercises, weight loss, diet management, and of course, avoidance of certain foods. based po sa advice ng aking mga friends from the medical industry and medical practitioners or licensed physicians, you have to simply just avoid certain activities and food that could actually agitate your prostate. On the topic of food, common food that you should avoid while you have prostatitis. Number one, you have spices. If in your case, whenever you would take spicy food, you would experience prostate inflammation or prostate sting, avoid spicy food. Caffeine, another cause po yan ng pag-inflame or pag-agitate ng ating prostate. Alcohol, and of course, red meat or meat. Also avoid oily food and also avoid salty food. So, yun po ang mga dapat na iwasan natin. Now, one thing you should know about prostatitis is that the medical industry is actually unanimous on this thought. Prostatitis is a basket case of medical ignorance. Each person has a different symptom. Every man who is inflicted with prostatitis has different causes, and they are infected in different ways. And having been infected in different ways, they have different and varying symptoms. Ergo, they require varying treatment or requiring varying cure, because if it's pathogenic, pathogens are not the same, and each pathogen requires different treatment or cure. I mean, not all antibiotics are created the same. Some bacteria are resistant to certain antibiotics. Just because you were cured by this certain antibiotic doesn't necessarily mean that other antibiotics used by other people would actually be effective as regards your condition. So, there you go. Ikakat ko po muna rito. If you have any questions, please post them on the comment side or on the page. I'll be happy to discuss the answers to you, and if you want, we could have a conversation. Na-realize ko po kasi na mahirap mag-discuss ng prostatitis ng nagmamonolog lang. Mas maaring makatulong pa po siguro kung question and answer tayo. So, schedule a live stream and feel free to call me. We will answer one by one your questions, hopefully within the time allotted for our stream or podcast, as the case may be. So thank you very much, and hopefully this would be the start of our lengthy discussions on this debilitating condition called prostatitis. Thank you.